the main takeaway or the main message is that humanized care is more than just how clinicians speak to their patients. It really has a lot to do with how we're doing as a healthcare system, all of us taking care of patients and making sure the patient care experience is better for our patients and the communities that we serve. So my name is Scott Wright. I'm a professor of medicine and I've been at Hopkins for more than 30 years. I lead general internal medicine. I direct our Academy of Clinical Excellence called the Miller Colson Academy of Clinical Excellence. And I also co-lead our initiative to humanize medicine with my colleague, Dr. Mary Catherine Beach. We're really excited that this empiric research will appear in Mayo Clinic Proceedings, as this is the second time that I'm getting to publish in this great journal. The title of our manuscript is a group concept mapping study to define humanizing healthcare, and it will be appearing in the January issue of the Mayo Clinic Proceedings. So this study was a really fun one to work on. We had a great team that was led by Sean Tackett, who couldn't make time for the video, so he stuck with me today sharing the study's results. This article used a method called group concept mapping to define what humanized care looks like in contemporary medicine. So I'm going to now share the main results of the study, and I'm going to show you a couple of slides. So for group concept mapping, there are really 6 steps that are followed, and I won't go through them in detail, but here they are. And it starts with brainstorming, and the prompt that we used with our 63 informants were, we wanted to name one thing that could be done to more fully humanize the healthcare experience. So we asked them to name as many as they would like, and we defined about what humanizing healthcare is and what dehumanizing is. And on average, each each person named 7 different ideas. And then they were sorted, and ultimately the computer generated this map. And the map ultimately led to our main findings, which are here. So in order to humanize medical care, if we start up where that arrow is, we need to ensure that healthcare workers demonstrate curiosity, compassion, respect, and humility for all. They need to communicate with patients in ways to accommodate their needs and create connections. We need to expand the time and patience given to our patients. We need to design physical and digital environments that improve patient comfort, convenience, and access. We need to align institutional priorities with healthcare values. We need to really do a better job embedding patient and community perspectives into all that we're doing. We need to reduce the burden so that it's easier to work in healthcare and that there's better teamwork. And lastly, we need to maintain a culture within healthcare that values relationships, growth, and clinical excellence. So I think a couple of other things that I'll say is that I've been lucky enough to have come to the Mayo Clinic in Rochester twice as a visiting professor, and Mayo does so many things wonderfully and are an example for many of us. And so I think, but many institutions, including Mayo and Hopkins, can even do better with respect to humanizing patient care. I think the findings in this study ought to be considered by all of us working in healthcare, particularly leaders and executives who are deciding how healthcare is delivered. Um, I think that those who come to see us for care place so much trust in us. We really need to make our system more humanizing so that every patient is treated with the utmost respect, dignity, and getting our full integrity. So I think the last couple of things I'll say is that the strongest and most prominent voice leading to that definition that I shared was that of the patient. We had many patients who gave us ideas of how to humanize the healthcare system. One of our co-authors, Gail Adams, has served on our patient and family advisory council for several of our practices, and she spent her career as director of community relations here at Hopkins before she retired. So what can patients do if they find this article? Or I think the patients really should seek out and demand humanizing care. They should want providers who get to know them as a person, connect meaningfully with them, and make sure that they're treated like a true partner in their care. Our Center for Humanizing Medicine is located under the umbrella of the Center for Innovative Medicine at Hopkins, and our project is supported generously by Mary Gallo. We're so grateful for her support. And now that we have a definition for humanized medicine, we're looking to set up Hopkins as the example of what an academic medical center could be that prioritizes humanized care. So to that end, we're launching projects and initiatives to amplify humanized care and really to eradicate any dehumanizing elements from many of our clinical settings. Thank you for listening, and I hope you like the article.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.